The COVID-19 has had a major impact on the lives of people and including their mental health. So some people, including health workers and even other frontline workers, have also been affected by the COVID-19 experience. Beyond the COVID-19 experience, it has also affected their mental health adversely. And in recognition of the World Mental Health Day, we choose to raise awareness around this, help people seek help, and according to the theme, which is mental health care for all, let's make it a reality. We at WebTV choose to raise awareness and make this a reality for everyone around us. Today, I'm at the Joy Hub here in Surulere, and I will be speaking with Damola Morenikeji, the CEO of Joy Inc. Let's go. Hello, Damola.
Hi.
How are you doing?
I'm doing so well.
We're doing mental health today. I'm not a therapist, right? But then again, how are you doing?
I'm actually doing so well. I'm really grateful for the things around me. So yes, I'm actually doing well.
That's very interesting to say. I wish a lot of Nigerians can say the same as of right now, but hopefully we know that someday things get better everyone goes through one thing or the other, but we hope that everyone feels well. Now, speaking of mental health, how important would you say that the state of mental health of a person, how important is it?
I think it's so important. I think it's as important as the other factors of their physical health and well-being and their spiritual health and well-being. It's important for us to be able to have a whole person. It's important that the person is in a good state mentally, physically, and spiritually. So yes, very important.
So what are the issues around mental health, and why is it that, as important as it is, why is it that it is one of the health aspects that is mostly shoved off? People really don't like talking about it. A lot of times we are just concerned about the physical state. I'm having malaria, we'll go to the hospital and whatnot to get that treated. But the emotional part, which of course is the mental health, why is it that we don't, in this side of the world, maybe we're creating awareness, right? But in this side of the world, it's not mostly spoken about. Why do you think so?
I think because most times it's easy to talk about the things you see, right? And regarding mental health, a lot of times you don't see these things. And beyond that, there's a cultural thing where talking about emotions, they seem as being too fluffy, too touchy a subject for us to talk about or take seriously in corporate times. But that's changing. That's really changing. That's mostly why I think a lot of people don't talk about it. We think that when you talk about how you feel, it makes you weak, or you're seen as being weak. You're perceived as not strong. We think that when people talk about being vulnerable, how exactly they feel, that they're not there, they're not strong. Unfortunately, it's a misconception, because when we talk about mental health, it's the same thing as saying when you take your physical health seriously, you become good physically. When you take your mental health seriously, you become sane. You become clear-minded. You get in a state of mind that helps you do every other thing you want to do faster, more clearer, with deeper sense of clarity. When we talk about emotions in the workplace, oftentimes it's always like, how do I even take a sick day off? Because how do I tell someone that I'm overwhelmed? It's just the little things. How do I tell someone I'm overwhelmed and I need a day off? Because I do not have a doctor's report to say I'm feeling headache and malaria.
It's sometimes insignificant.
Exactly. So we need to, and I'm glad a lot of people are, we need to start taking the little things seriously. Do we have an environment, for instance, in the workplace or at home, that is safe enough for people to be able to talk about how they feel, for people to talk about what they're feeling at the moment? Is it safe enough for people to be vulnerable about their emotional journeys? Because all the research has shown conclusively that when people are happy, they are in that best state to be able to innovate. They are in the best state to be able to bring their best foot forward. They're in a state where they can actually transform the culture and transform the world. So it's too important to be left aside.
Yeah. So now I think you pointed out that it is the little things that matters. And of course, these little things can serve as triggers. I know you are like really, really skeptical about talking about triggers, but then again, it is the reality. That is what we see. That's how people, it's just those little things that trigger people. And it's a wide spectrum, just like you said. So how do we begin to identify these things for people that do not know? Because I was in that state of unknown for a long time. And I'm sure that a lot of people are also in that state of unknown. So how do we begin to identify these unknown things, these little things that triggers us and then it gets into some kind of dwindled situation?
Well, I think the most important thing to know the triggers is, and this sounds somehow, but really get to know yourself. Let's start with that. Get to know yourself. So you know how you feel when you are functioning optimally, right? When you are not, then that's the time to start asking the right questions, like, how exactly am I feeling now?
Yep.
What exactly am I feeling now? Sometimes it's best to actually name it, right? Am I feeling bland? That's a feeling where really you just know something is off. You don't know exactly what it is. Am I feeling sad? Am I unhappy? Am I angry? You know, what exactly is the emotion I'm feeling now? I think beyond that, once you've been able to identify it, it's sometimes best to be able to move forward to say, what thing or person triggered that? Sometimes it doesn't really have to do with someone doing that to you. Sometimes it's just something in your environment that reminds you of something you'd already gone through a few years before that, right? And what exactly are you going to do about that? I think that the most important thing is to focus on the action. And sometimes the action could be, I'm going to talk to someone about it, right? Sometimes the action could be, I'm going to talk to a friend. I'm going to write about it. I'm going to see a professional about it. So I think we just need to look at when you're not functioning optimally, when you don't feel optimal, get the help you need.
Now, speaking of help, which of course is why we are doing this, because the theme for the year is mental health care for all. Let's make it a reality. And how do we begin to make it a reality? By providing help for people. I'm sure all over the world there are lots of therapists, and it's a professional thing that happens. But let's bring it down home. Let's talk about Nigeria. What are the helps? Like, how can people start accessing help? How available, how accessible are these helps that we even have? So let's first of all point out the help that are available, then how accessible are these help?
Okay, so I'm a bit of an optimist.
Okay.
Help is available everywhere.
Okay.
And I'm declaring this on national TV.
That's good.
But help is really available everywhere. So for instance, there are a lot of mental health organizations, private companies who are working on mental and emotional health. From the top of my head, I can name some of our friends who we've worked with, like Mani, that's Mental Health Nigeria, She Writes Woman.
Yeah.
Olama Cares.
Alex Coaching Company.
Yeah?
Alex Coaching Company.
Exactly. So there are lots of professional organizations that are dedicated to mental and emotional well-being. A lot of them are non-governmental organizations So I think that we can actually start from there.
Okay.
Beyond that, there are organizations that provide therapy services, private physicians. Though we have a challenge in the country based on as far as that's concerned, because we have a very high disparity of number of physicians to number of those that can access them. Yeah. It's quite appalling. Yeah. However, in spite of that, we have several other people within that whole spectrum, within that whole space, within the mental health space, that can actually help. Yeah. I'd mentioned Mani, I'd mentioned She Writes Woman. When people need help, sometimes the best thing you can do is to say, call for the help. Yeah. Right? Some of these organizations run helpline services that you can just call to talk to someone. For instance, Olama Cares and Joy Inc. runs a network of listeners that you can just call, and they are there, they've been trained to just listen to you and advise on what you should do next. You know, it's just a plethora. For instance, on the Joy Inc. website, we have a page where it's just full of a lot of helplines, people you can call. I know that a few states in Nigeria have emergency crisis numbers for things around mental and emotional health. So just visit the webpage. I'm sure you're going to put that up.
Yeah.
Visit the webpage, look for anywhere, look for any of the contacts that you think can really help you. Either you're in Nigeria, you're in Cameroon, or any part of Africa or the rest of the world.
Now, so I like the fact that we've talked about the help. But then again, some set of help come with a cost.
I know you were going to go there.
Yes, it comes with a cost. And I think that that's where a lot of people have problem with. To be fair, things are, I just want to put it out there that we all need help. One way or the other, we all need help. But then again, some sort of help comes with a cost. And of course, therapy is not free. There's been so much agitations about therapy. People go for therapy. And they say it as if it's just 1.5 naira that I'm going to pay for therapy. It of course comes with a cost. And this has said of some of these people, their problem might even be as a result of financial constraints and whatnot, that they are being depressed. And you're expecting them to pay a certain amount of money because money is their problem. Do you understand? So how do we begin to address that situation when it comes to therapy and the cost attached to therapy?
I knew that was coming first.
Yes, it was. It had to be said.
However, I think we've actually made massive progress. So I look at things now and talk about things now from a perspective of a long-term perspective, right? So for instance, we didn't have it this easy, so to say, 10 years ago, right? We've made massive progress. So first, I think it's necessary to acknowledge that progress.
Yep.
However, have we gotten to a point where every man on the street can access this? Maybe not. Maybe not. However, I'm seeing daily new models springing up where a few startups, for instance, or insurance companies are trying to make it affordable for people, just the same way they've tried to make physical health affordable. We know the state of that. So just the way they've tried to make physical health affordable, I've seen a lot of people trying to also make access to therapy affordable. I think Unequal Health, for instance, is doing a fantastic job in that area to just make it very affordable for every man. However, I think there's still need to do a lot of work in that area. There is no one solution to this. It's unfortunate that that's the situation. It's unfortunate that poverty is a huge, huge problem. However, not to answer that question, but however, I actually think that we're making progress in that area. And that's also to call for other people. We all need a very huge concerted effort by all parties involved to make sure that this is affordable and cheap for everyone. Let me start with, and that responsibility should not lie on the practitioners. It shouldn't lie on government, or it shouldn't lie on corporate organizations solely, right? Let's start with corporate organizations. Corporate organizations should be ready, right, to make access to mental and emotional well-being affordable for their staff, right? Yeah. Government should be prepared to do the same for those that are working in civil service, for those that are working in civil service, right? So it just requires a level of commitment across board for us to really make that possible, right? The cost of therapy may not be as cheap as we want it to be, but we're making progress in that area. But I know of a number of people who are committed to making this work, right? And I'm very optimistic, right? So I'm just optimistic that things are going to work in the long term.
Yeah. So let's quickly talk about Joy Inc. for a minute, as short as possible. So what is Joy Inc. doing in this regard?
So in
mental health people,
to help people,
mental health conditions.
So we come from we look at this problem from a human flourishing lens.
Yep.
So we believe that it is very possible for people to be happy, not in spite of the challenges, but actually because of the challenges. We think that it's very possible for people to build resilience, for people to thrive in spite of what they are going through daily. And we're lucky to have been backed up by decades of research around what helps or what makes people flourish, right? So for instance, there's this Harvard grant study that I like referring to, where a team of researchers at Harvard studied several people for over 70 years. And they were just asking the little questions like, okay, what exactly makes these people thrive? What exactly makes people flourish? And they measured everything, everything from their height, their complexion, the color of their skin, to the size of their testicles, everything. And they noticed that what really makes people flourish is love, being in a loving relationship, right? And that could be loving relationship at home, at work, right? So what we do at Joy Inc. is to provide people with that tool to make this research and knowledge easily accessible and create a safe space in government and business and culture for us to be able to really flourish well. We also run the Joy Hub, which is run in partnership with Olama Cares. At the Joy Hub, we run a non-toll-free line where people can call whenever you're having a mental health issue. You can just call. It's 0700 the Joy Hub. So that's really what we do. And we think that we're grateful first. We're grateful that we're able to support a lot of other organizations working in this space. We're grateful for that effort. And we think that with time, this is one of those areas where they say time heals a lot. With time, people will truly get to that state where they can be happy every day of their life.
I mean, that's like a good way to end this conversation. With time, everyone will get to a point where they will be happy with their life. Thank you very much.
Thank you so much.
Thank you for sharing this with me. I mean, for answering my very most important question about the cost attached to therapy.
Definitely.
And the take-home for me would definitely be understand yourself. Show love to your next door neighbor. You never know what the next door neighbor is going through. Care for one another. Try as much as possible to be happy. And most importantly, seek help where it is very much necessary. Thank you for watching. It is the World Mental Health Day, and we recognize that we choose to care for one another and make this a reality. So join us in the cause to make this a reality, create awareness around it, speak about it, seek help most importantly. And yes, we're just on our way to being happy, and most especially being happy as a nation in general. Thank you for watching. Please enjoy the rest of your day. Bye.